You're watching UNICEF television. Over the last decade, Zimbabwe has seen a decline in its healthcare services, resulting in a dramatic increase in child and maternal mortality. Every day, at least 8 women die due to pregnancy-related complications, most of them in rural areas with only limited access to basic healthcare services. In a country that calls for free care for pregnant women and children under 5, lack of sufficient funding has forced many institutions to charge for basic services. 30-year-old Tendai Mudadi knows this all too well. She had to be transferred from her local hospital to Marondera Provincial Hospital, where she and her husband welcomed a healthy baby boy into the world. Now, however, they're worried about not being able to pay the hospital bills. Just paying for transportation to the hospital was a financial stretch. Many women end up delivering outside of basic healthcare facilities altogether, leaving them at a higher risk of death in the absence of skilled birth attendants. To combat this alarming trend, the inclusive Government of Zimbabwe, in partnership with the international donor community and UNICEF, took an unprecedented step and launched the Health Transition Fund. The fund seeks to revitalize the healthcare system and reverse the alarmingly high maternal and child mortality rates. At the recent launch event for the fund, there was much to celebrate.
In keeping with global best practice, the Health Transition Fund will now integrate the critical major programs of maternal child health, HIV, and nutrition.
The fund is the first major national program in the health sector to integrate maternal and child survival programs and signals progress for the country's healthcare system overall.
Long back in the 1950s, in my own rural home in Boera, I remember my mother carrying me on a bicycle all the way 50 kilometers to go to hospital to access medical care. 50 years later, women in Zimbabwe cannot be seen to be walking similar distances to access basic health care for their children.
The Health Transition Fund will also fund medicines, equipment and personnel and assist in the development of health policy and planning. The establishment of the fund is a big step on the road to ensuring that all Zimbabweans have access to basic healthcare services and are able to bring their children into the world in a safe and healthy environment. This is Anja Baron reporting for UNICEF Television. For more information, visit unicef.org. Unite for Children.